Hello and welcome to another video on our channel. In today's video, we will discuss a highly commented topic, ADHD, Attention Deficit Hyperactivity Disorder. We have another video explaining what you need to know about ADHD. We'll make sure to link it above, so if you didn't watch the previous video, we highly suggest that you do. Because, in today's video, we are going to talk about the requirements to get diagnosed with ADHD. As we mentioned in our previous video, ADHD is a disorder that affects the development of self-control. It is marked by deficits regarding attention spans, impulse management, and activity level. Throughout history, it has received various denominations. The medicine in the mid-19th century considered these individuals as children who had a defect in moral control. Later on, that definition changed to a child with a mild or mild mental deficiency that might have been affected by encephalitis lethargica and was hyperactive, hyperkinetic, or perhaps who had a moderate brain dysfunction, to finally reach the conclusion that ADHD kids, as we know today, have attention deficit and hyperactivity. In kids, it is essentially characterized by difficulty in maintaining attention, agitation, and restlessness, which can often lead to hyperactivity and impulsivity. These symptoms follow a persistent pattern and are more frequent and severe than similar manifestations present in children of the same age and developmental level, as it is quite common for children to present more active, inattentive, and impulsive behavior than adults. Given the aspects we just mentioned, the importance of a comprehensive assessment of the child's functioning is evident. For this to be accomplished, there is a range of techniques and instruments that can be used to enrich the evaluative and diagnostic process, such as clinical interviews, the use of scales, and psychological and neuropsychological tests. The multidisciplinary exchange is extremely valuable, as the exchange of information between professionals from different areas, such as psychiatrists and psychologists, can be very useful for a more global understanding of a case. Before we talk about the tests used, it is necessary to understand the process that precedes the search for a diagnosis. Children with ADHD are commonly described as disconnected, bored, and unmotivated in the face of tasks, weak-willed, messy, and disorganized. Several complaints and the lack of results sometimes is enough to raise the suspicion that medical aid is necessary. The suspicion of the diagnosis of ADHD should be raised in the presence of children with symptoms of hyperactivity, inattention, and/or impulsivity that have been present since childhood. These symptoms must be clearly inappropriate for the age, social, and/or educational environment. As a parent, you might just be in the best position to see how your kid behaves and how long some behaviors persist in order to answer the questions your doctor will most likely ask. There are three main subjects that you, as a parent, should keep in mind. These are the main symptoms of the disorder. 1. Hyperactivity. 2. Impulsivity. And 3. Lack of attention. When it comes to hyperactivity, there are a few things that you should observe. Does your son or daughter move around in excess when sitting? Is the child running or hiking non-stop? Does the child often have difficulty playing or quietly engaging in leisure activities? Does the child talk too much or have difficulty letting a subject go? Impulsivity can be a bit more difficult to notice, but keep these questions in mind and you might have a better idea of what you should look for. Does the child often give hasty answers before the questions have been completed? Does the child often have difficulty waiting for his or her turn? Does the child frequently interrupt or intrude on conversations or play? Now, inattention is a very broad topic. Kids can lose their attention due to anything. Maybe they're studying a subject that doesn't interest them, or that new toy you bought wasn't what they wanted. So, how can parents identify that lack of attention is a serious issue. The key word is frequency. Does the child frequently fail to pay attention to details or make careless mistakes in school, work, or other activities? Does the child often seem not to listen when spoken to? Does your child not finish their duties at home or do it halfway, forget something? Does the child often have difficulty organizing tasks and activities? Is the child often distracted by stimuli unrelated to the task at hand? Does the child frequently forget about daily activities? By paying attention to these questions, parents can get a better idea of when to suspect attention deficit hyperactivity disorder in their children. Now that you're worried, it's time to look for a specialist to evaluate your child. Since ADHD is a complex disorder, it can't be determined with a simple test. It's necessary a detailed assessment, which includes a physical examination to rule out other causes, interviews with the parents and the kids, and reports from parents and teachers. To be diagnosed with ADHD, your child has to meet either criterion. She or he needs to have at least 6 symptoms of lack of attention or 6 symptoms of hyperactivity or impulsiveness, which is why assessing the child and their behavior are extremely important for parents. Before considering the diagnosis of ADHD, the child should undergo a formal auditory and ophthalmologic assessment. Also, it's important to know that there is no laboratory test that helps in the diagnosis of ADHD. Many signs of ADHD expressed in the preschool period may reflect a communication problem that also occurs in other neurodevelopmental disorders. These symptoms need to have started before the pre-adolescence. The doctor needs to know whether the child is distracted by external factors, events in the environment, or internal factors, thoughts, anxieties, and worries. A more comprehensive assessment should include a history of prenatal exposure, perinatal complications or infections, central nervous system infections, traumatic brain injury, heart disease, sleep breathing, poor appetite and/or selective eating, and a family history of ADHD. School also plays a significant role in diagnosing ADHD. Educational assessment documents, core signs and symptoms, may involve reviewing educational records and using assessment scales. However, these scales alone cannot distinguish ADHD and other developmental or behavioral disorders. Here, we are emphasizing the importance of the teacher for the diagnosis of ADHD, but it is essential to remember that these professionals are not responsible for the diagnosis, but that they must share with other professionals both observations and changes or events that occurred in class. The teacher is essential for signaling the symptoms of ADHD present in students, observing their reactions to established rules and orders, how they learn, their relationships with others, their behavior, and evaluating their learning, getting to know the student better, and their individual skills. Educators should be aware of the student with difficulty in organizing or planning for learning activities, who regularly forgets homework, students that don't read the questions to the end before answering, or students who talks a lot during lessons and seems unable to sit still in their chair. If you are a teacher or parent and you observe these behaviors in a child, it is important to see a doctor so that the child or adolescent undergoes an evaluation, which may involve different specialists such as a pediatrician, psychiatrist, and neurologist. And, in case of a positive diagnosis, a treatment plan should be drawn. If you're a professor and you suspect a student might suffer from an attention disorder, there are a few things you can do to make his or her experience in school easier. As a teacher, you can guide your students clearly and objectively. You can always place the child with ADHD to sit closer to the blackboard, away from doors and windows, so that they are not easily distracted, and make notes on tests so that the student understands the mistakes and successes. Avoid very long instructions in activities and tests, and if you're unsure if the instructions were clear enough, ask the student with ADHD to repeat the instructions. But always avoid negative exposure in front of other students. These are decisive periods for the development and formation of the child. Parents and teachers must know the characteristics of attention deficit hyperactivity disorder and understand the role that each of them has in the diagnosis, treatment, and coexistence. Do you suspect your child has ADHD, or maybe one of your students? Let me know why in the comments down below. Thanks for watching, and stay tuned for next week's video, which will go over ADHD diagnosis in adults.